Urinary incontinence. Is it normal? It's not normal. It's not a natural progression of aging. But do women suffer from it? Absolutely. And you don't need to have had children to have a weak pelvic floor. That's a misnomer. Even young, active women have weak pelvic floors. There are many things you can do to strengthen that pelvic floor. A lot of exercises. Pilates is wonderful for it. Doing Kegels during the day, but making sure you're doing a proper Kegel. So a Kegel, what I used to tell patients is to get the sensation. You're going to the bathroom, you're peeing. Stop the urine flow. That is a Kegel. Now, I don't want you to continue to do that when you pee. But when you're sitting on the couch and you go and you try and contract the area, I laugh because I'll get a twitch in my eye as I'm trying to contract the area because it's not easy to do. And there's ways you can do it. You can do quick Kegels or you can do contract and hold. You're supposed to do about 100 a day. So I would try and do them when I'm watching TV, when I'm waiting in line at the grocery store, or I'm at a stoplight. How to know if it's getting stronger? Well, if you have a partner and you're sexually active, you actually can have them stop in the middle of intercourse, and then you can say, I'm going to do my Kegels and tell me if you can feel it. And then you can do your Kegels and they can tell you whether it's getting stronger or not. And that's one way. The other is you are seeing a physical therapist, but I would specify a pelvic physical therapist, one that specializes in the pelvic floor. And there's also different tools you can use. There's a stimulation. I forget the name of the product, but it has two probes. One is for urinary, but they can also do a rectal probe too. And it actually is electrical stimulation because sometimes the vaginal muscles are so weak that you can't even contract it. And that will stimulate the muscles until they get strong enough so then you are able to take over the exercises from that point. And that can take many months to get to that point. There are also urogynecologists who specialize in this area. And there are interstims that can be placed in your buttocks, your glute area, which send a stimulus into the area of the bladder and can help the bladder stimulate and empty. So this is more in people who would have a neurogenic bladder. That can be helpful in some cases. So I guess what I should have said is getting evaluated first to see what your urinary incontinence is due to. Is it more urgency or is it more frequency? And those are the specialists that I talked about. But what about in young, healthy women who don't have these issues? My daughter is a weightlifter, and I've told her so often, please, please, please work on your pelvic floor. Because weightlifting, especially when you're pushing things up, you bear down, and that can cause weakening in the pelvic floor. Because if you think about it, you know, you got your pelvis right here and your spine, but there's no bones holding up this uterus and bladder area. So if you're lifting and you're bearing down like you're having a bowel movement, that's just going to bulge down. So really working on when you're lifting proper alignment and not lifting too heavy that could cause that strain.